Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. Today we are going to discuss a very important and a common topic, hypertension. Hypertension is not only common in India but it is a global problem. So hypertension, what are the causes that are there and how are we going to prevent it is what I'm going to discuss about today. Hypertension can be primary or it can be secondary. So what do I mean by primary and secondary? Well, primary is where we have modifiable as well as non-modifiable causes, whereas secondary is usually because of some other disease. Let's say that you have a vascular problem, you have a heart disease, you have a kidney issue, all these things, or if you have a tumor or you have a steroid excess or you have a thyroid disorder, all these things can result in hypertension, where once we treat the underlying condition, it is going to be cured completely. Whereas when we talk about primary, this is mainly because of certain non-modifiable and modifiable causes where the main problem is itself hypertension and we have to treat it. We have to get your BP under control to prevent the complications of hypertension. So what are the non-modifiable ones that I am talking about? One is your parents, that is genetics. Let's say your parents or grandparents had hypertension or have hypertension, then definitely you are at a risk of developing hypertension and you need to work on the physiological changes that you can bring about in your life, like weight reduction, etc., to prevent it. Number two is your ethnicity. Let's say I'm an African, then definitely because of my ethnicity, I am slightly more prone to develop hypertension as compared to the rest of the world. Third is my age. As I age, my chance of high BP increases further because my receptors are getting weakened and my body is physiologically aging, so my BP is going to be on the higher side. Are there something that can be modified? Yes, of course, there are multiple modifiable things. So number one is obesity. Yes, of course, if your weight is on the higher side as compared to a person who is normal, you have a higher chance, whether you're overweight or you are an obese individual, you are at a higher risk of developing BP. So what can you do? Of course, you can reduce your weight to maintain a normal BP. Abdomen opacity plays a very important role. So let's say that your weight is normal, you're a normal individual, but you have abdomen fat, then definitely you are at a higher risk of developing hypertension. So abdomen crunches and exercises to tone your abdomen muscle and abdomen fat will definitely help you. If you're someone who takes high salt in your diet or you love pickle, then definitely you are at a higher risk of developing hypertension because sodium is very important in the BP pathway in maintaining your blood pressure. If you are not taking enough potassium in your diet, then you are again more prone because sodium and potassium are inversely proportional. So what you should do is you will have to take bananas. You can go for sapodillas. You can also go for nuts, provided it is not salted. Maintaining a good potassium level in your body definitely prevents hypertension. Make sure you're not having a sedentary lifestyle. Sedentary lifestyle itself is a risk factor, so make sure you're doing regular physical activity. Stress, whether it is your physical stress or mental stress or work-related stress, personal stress, all of them play a role. We can't avoid stress, so the best thing is to cope up with stress. So you can try going for meditation, yoga or something like that so that you can prevent it. If you are someone who works late at night, then lack of sleep is again a risk factor for developing hypertension. So you cannot change your job, you cannot avoid your income. What you can do is basically compensate for the sleep that you have missed in the night. Make sure your room is dark, there is no noise, have adequate soundproofing, and you can use earplugs or something like that. And you can also cover your eyes with iPad and sleep at least for 6 hours continuously. That would help prevent this. All these can be simple measures, but they help a lot in preventing hypertension. So let's say that you're already diagnosed with hypertension. How are you going to identify it? Well, majority of the time it is a silent disease. you don't identify it. It is found during your routine health check. Other than that, some people do complain of headache here or in the back region. Or some people actually come with complications, either with heart attack or a brain stroke and paralysis, and they come to us. So it is always advisable to prevent the complication. It would be ideal if you get your BPs checked at least once in 6 months, so that we identify it at the earliest and we can prevent the complications of hypertension. So what all will we investigate once we have found that you have hypertension? Not just your BP monitoring, but also we look for other organs. Like I had mentioned, other organ involvement can cause hypertension, or your hypertension itself can affect other organs. So we look for your thyroid profile, we do your basic biochemical workup, we check for steroid levels in cases where we are suspecting a steroid excess resulting in it. We check your kidney profile, we look for your heart health. We look for all these parameters depending on whether we are looking for complication or other causes. We might even ask you for certain imaging like ultrasound, abdomen and all, or we can even ask you to go for a chest x-ray, or we might ask you to go for further investigations like CT or MRI based on what we are suspecting. Let's say I am suspecting an abdomen tumor that is causing it. So in that case, I might ask you for a ultrasound of the abdomen, or it's a lung cancer that I'm suspecting, which is resulting in a high BP. So then I might get your chest x-ray, or I might, if I'm suspecting that you're going into a stroke episode, then I might get a CT or an MRI based on your manifestation. How are we going to handle, that is, live a healthy life with hypertension and prevent complication? Well, we have to handle all the risk factors basically. If you are a diabetic, then definitely keep your sugars under control, because sugar and BP will accelerate progression towards your end organ disease. So what do I mean by end organ disease? That is basically your kidney involvement, your heart involvement, etc. So what we basically tell you to do is keep your sugars under check, keep your BP under check. Go for regular physical activity for at least half an hour every day for 5 days a week. So minimum should be 150 minutes of moderate physical activity every week. Apart from that, make sure you're taking a low salt diet, potassium rich diet, maintain your calcium, magnesium levels so that your body in general is in good health, so you don't worsen further. You will have to handle your stress levels with meditation, yoga and all. Have a good hobby. Maintain your mental health. Mental health is one of the major risk factors. Whether you have depression, anxiety, all of them can cause. So you can go for meditation, yoga, you can do some music, you can do some artwork, you can have a good quality sleep. All these things will take care of your health. Make sure you're not eating excess of spiced food or excess of salty food. Packaged food is a definite no, because all of them contain a lot of salt. Salted food, pickling, etc. has to be avoided as much as possible. Good quality sleep and quantity sleep. Minimum should be 6 hours, maximum of 9 hours of sleep should be there. Make sure you follow all these simple measures so that your BP is well maintained. From our side, we will be providing you with medications. So it might be a single pill once a day, or it might be multiple pills based on your requirement. And once we identify a complication or a risk factor, let's say that we see that your cholesterol is slightly borderline, even if it is not going to be an independent risk factor for you, because you have hypertension, we might be starting you on a cholesterol medication and modify your diet to be a low fat diet to prevent complication related to that. If you're a diabetic, then again we are going to restrict your carbohydrate and your sweet intake, etc. So depending on the additive factors that are associated, we will be treating the associated condition as well. Last but not the least is smoking and alcohol. If you're a smoker, definitely quit smoking. Alcohol to be consumed in moderation. If you are a lady, take about 50 ml per day. If you are a male, then take about 30 ml per day. Best would be to avoid it. If you're someone who cannot avoid, then this would be the preferred one. I hope this video was useful and informative. Follow me for many more interesting videos. Thank you.